but you're not gonna tell us, okay, so you're gonna do like the, what is it, the anterior Georgia, I mean, not
Yeah.
ENT. You can tell us what you're assessing. I'm assessing which ligament. But you're not gonna have to say,
You're gonna have to say varus valgus. What you're.
but just for what ligament you're assessing, you're not trying, so what I'm trying to say is, if I come in with a coughing congestion and I've got pertussis, you're not telling me I'm looking for X, Y, and Z. You're gonna tell me what you're going to assess just to listen. Does that make sense?
While using medical terminology, which Missy's not, red is one of Dr. Weddendorf's biggest pet peeves. Yeah. Family practice going forward, if you ever prescribed Levaquin on any of your scenarios, he'll tell you. Trying to think of what other pet peeves you have. I'll think of them. We'll give you some warning. Okay.
Speaking of which, did our former student not kill Ms. Johnson? Did she live with the Cipro that was given with her cardiac condition?
She lived, but they discharged her home and she'll be following up and they did not do a pacemaker.
Okay, all right, fine.
Yeah.
Okay, all right. So you'll come in, you'll have some vitals as such, right? You may have a few other things on there. For now, though, we're just gonna do vitals.
What
okay?
else would you put up there?
Well, that's right, we can because we have
Yeah.
different swapping out. We're swapping out, yeah. All right, fine. Or we may just verbalize the vitals to you, okay? But you'll get those. You should be able to recognize, hey, there's something here that I know I'm gonna have to address off the bat because this isn't right. In this case, this would be what? Great, okay, all right. So just, again, this seems rudimentary right now, but I guarantee you when you're in here and your heart's beating twice that rate, right? And your brain's being deprived of oxygen because you're in full-blown panic mode. We've had folks who have completely blown by something like that and not even recognize that. It's like right there, okay? So again, just take a breath, all right? Okay. So, walk in and we'll give you the scenario. Hey, you, today in clinic, you have this lovely 29-year-old female who presents today with the vital
49.
signs that was just given. That was
I don't want to be 29.
generous. So,
I am 49.
you have this lovely 49-year-old female who presents today with a chief complaint of headache, okay? And also had mumbled some stuff to the MA or nurse when she was getting her vital signs that there were some other things that she wants to talk to you about today. Okay? But you don't get all of those. You will get a chief complaint. It does not mean that that is the only thing that needs to be assessed or addressed, right? Okay? So, that's how it's gonna go. Santana or Cuban, do you guys have stethoscope anymore?
Bring out your eyes.
Okay, all right. So, it's not pretty, it's not pink. It's not pretty.
I'll pay you to do your full.
They don't get that yet.
Not
Maybe-
yet?
Maybe one day if they're
Have you seen it?
doing clinicals, so.
He makes the best girl when he does his impression.
Usually just when I'm hanging pictures or doing some decorating, but anyway, it's a whole other persona.
It's fun.
All right, so we've got our basis for our scenario. Yeah? Okay. Normally, we would, and that's what I was trying to look for. We used to have little
We
clinical
do.
stools we used to sell, but they aren't available anymore. They don't even in the storage room anymore. So hate standing over a patient talking down to them, okay? But since our clinical stools have disappeared since last year, that's just the way it's gonna have to go, okay? So we'll have that. This would be probably placed more over here, okay? But I'm just gonna leave it there for now because you guys have stuff on it, okay? So that's gonna be it, and then someone's going to have a timer and say, any questions last minute before we start the scenario? By the way, we can talk to you, you guys can't talk to us during the practicums, right? I mean, you're verbalizing your findings when you get to your physical exam, but you can't like stop and ask us, did she say that she had left knee pain or right knee pain? Right? Okay, that's on you, just like we were talking about. So just be clear on that, right? And again, if you aren't verbalizing things as you go, that's where we're gonna start interrupting you, and we're gonna be, we're gonna be talking to you. So that's why you wanna limit those interruptions as much as possible, so that we don't have to do that, all right? So everyone good on that? So we'll say, hey, any last minute questions or any questions about the information that you've been given before we get started? No, okay, good to go. Okay, just remember, quick reminder, we can talk to you, but you can't talk to us. Try to verbalize everything as you go when you get to the physical exam. Then we'll ask you, do you want any time checks once we start getting down to the nitty gritty, if it gets to that point. And that's for you to say, yeah, I'd like for you to give me let me know when I have 5 minutes left, and then maybe every minute after that, or whatever you want, or hey, no, I don't need any time checks, I'm good. Okay, so that's it. And then we'll say, all right, so your time starts now. There's hand gel, right, on everything. We expect you before you lay hands on a patient. So we'll try to get those replaced before next week. So come and introduce yourself. Hey, good morning. I'm Brent. I'm going to be taking care of you today. So I understand you have a headache today. Is that correct?
I had a headache
Had a headache. When did it stop hurting?
last night,
Okay, and it started when?
about 5-6 days ago.
5 or 6 days ago. Do you typically get headaches that last 5 or 6 days?
Not in a long time.
Not a long time. You've had them before.
I have.
Was this similar to previous headaches?
It was. I just felt like my vision got impacted this time.
So in terms of vision got impacted, what do you mean by that? What was going on with your vision?
I don't know. It just felt like it got like fuzzy or something.
In both eyes or just one eye?
I didn't check both eyes. I don't know.
Okay. Any blurred vision?
A little bit. I just didn't feel like I could see outside all the way.
Okay. Just on the left side?
Mainly.
Okay. Any bright lights around objects?
No,
Seeing
but
weird
lights
shapes?
really bothered my eyes when it was going on.
Lights bother your eyes with the headache. Is that typical with the headaches that you get?
Yeah.
Okay. So aside from the light sensitivity, any noise sensitivity?
No.
Okay. Any nausea?
Yes.
Okay. Any vomiting?
No.
No. Any belly pain associated with the nausea?
No.
No. All right. Hadn't recently hit your head on anything or fallen?
No.
No.
I'm very tempted because, you know, we had the patient
You're
this
not
week.
a stripper who was on a pole. Don't go back to a couple of years ago. All right.
Fine, I did not hit my head.
Okay, great. Did you take anything over the last 5 or 6 days for your headache?
Some Tylenol.
Okay, did it help?
Maybe a little.
Okay, all right. When was the last time that you took some Tylenol?
Last night.
Last night, okay. How many did you take at a time?
Just 2.
Was it regular strength or extra strength?
Extra strength.
So 500 milligrams, okay.
Maybe, I don't know.
Was it mixed with anything else? Was it just plain Tylenol? Was it like
Just
Tylenol headache or?
Plain Tylenol, but, you know, I may have had a glass or 2 of wine with it.
Got it, okay, all right, fine. Okay, so how would you describe the headache? Sharp, stabbing, throbbing, none of those, all of those, something different?
Throbbing, it hurts more in my temple area when it happens.
Okay, usually just on that left side.
Yeah, and then I'll kind of feel it going down my neck a little bit.
Okay, the same side that you had the vision impacted on, correct? Okay, all right, fine. Okay. How many of those type of headaches have you had within the last month?
Probably 4 or 5, they just didn't last so long.
Got it, okay, all right, fine. Okay, so to recap, headache that broke sometime since last night after you took the Tylenol, but prior to that, had been going on for 5 or 6 days, primarily on the left side, had some difficulty seeing peripherally on that left side, and then you had some nausea and light sensitivity, had not hit your head, correct?
Correct.
Okay, all right. Aside from the Tylenol that you took last night, any medications that you take on a regular basis?
No.
No. Any over-the-counter vitamins or supplements that you take?
Sometimes I take a Flintstone.
Flintstone vitamin, okay, all right. Are you allergic to any medications?
Nope.
No. What about medical products, sticky tapes, latex, iodine? No. Okay, all right, fine. Any other medical issues that you have on a continual basis other than the headaches?
I feel like my heart races kind of frequently.
Got it, okay. Have you ever been told that you have palpitations or any sort of heart arrhythmia?
I think you told me that in my last exam.
Oh, so we're seeing each other, this is a chronic visit.
Yeah, you just don't
I was
remember me.
acting like we've seen each
I
other.
had my
for the
hair
first
changed
time.
since then.
You guys will be having to act like you're seeing each someone for the first time, but anyway, all right, she's driving further than I'm old and senile. Okay, all right, we'll go with that. Okay, so, but nothing that you had to see a cardiologist or heart specialist
You
for?
mentioned it, I just never did it.
Got it, okay, all right. Any surgeries in the past?
On my knee, I had surgery.
Which knee?
The right, it was just
Right.
a meniscal tear.
Got it, okay, fine.
And I had a gallbladder removed
Okay.
and a hysterectomy.
Anything that you didn't necessarily have to stay in the hospital overnight for? That was like an in and out, same day type kind of thing?
My hysterectomy had to stay, and then a group of us nurses had meningitis at the same time. I don't remember how long ago that was. How long ago was that, Jen?
I was 15 months old, so
Yeah.
16 years ago.
16 years ago.
Got it,
Yeah.
okay, all right, fine.
And we were in for a long time. I don't remember the hospitalization at all. Dilaudid was kind of interesting, so I don't know.
Okay, all right. Okay, let's talk about family history for a moment. Parents still alive?
My dad is
Dad is. Okay, any health issues with him?
diabetes, heart disease, chronic kidney disease, ornery-ness, insomnia, anemia,
What did your mother pass away from?
COVID.
COVID. How long ago was that?
Poly. How long ago was that? 2020, 5 years.
Okay, all right. Any siblings?
I have one.
Any health issues with siblings?
She's crazy.
Crazy, okay. Any formal sort of mental health diagnosis that you're aware of?
Yes.
Okay, all right. What would that be?
Depression, anxiety, Munchausen's.
Okay, so quite a few things going on there, all right. Any health issues with grandparents that you can remember might have been discussed?
Breast cancer in my grandmother. My grandfather had a CVA. My other grandmother had ovarian cancer, and my other grandfather had lung cancer.
Okay. All right. Let's talk about your social history for a second. You said a glass of wine last night, so how often do you have a glass of wine, would you say? Is that the only alcohol that you consume?
Usually only wine, maybe
Okay.
once or twice a week, depending on if my partner at work has left me all week.
Got it, okay, all right. Married?
Married.
Single, divorced, married, okay, children?
Or
Great, okay. What do you do for a living?
I'm a nurse practitioner.
Okay.
I'm not a stripper, I think about it, but it just never worked out.
Any tobacco use current or in the past?
Never.
No, okay, all right. Exercise?
Yes.
Yes, what do you do on a routine basis? And-
I do
How often?
usually just walking. I like to jog, but my knees don't like it so much, so.
Got it, okay. You mentioned your knees a few times. You mentioned the surgery on the right knee in the past. No issues with that today, because the nurse had mentioned that there were a few other things that you wanted to talk
My
about
shoulder.
besides your headache.
My left shoulder
Left
just has
shoulder.
been hurting.
Okay. Any injuries or falls with that left shoulder?
No, not that
Okay.
I
How
remember.
long has it been hurting for?
Since I returned from a flight a few weeks ago.
Okay, can you kind of point to the area and kind of show me where you feel the most pain
It
at?
hurts right in here, and then it'll shoot down into that shoulder and down my arm a little bit.
Oh, okay, all right, so shooting pain is how you would describe that.
At times, if I move a certain way, it'll do it.
Numbness, tingling, burning, anything, electrical sensations going down that arm? No, okay, all right, fine. The Tylenol that you took for your headache last night, did that help with your shoulder at all?
Oh, yeah.
Okay, all right. And anything seem to make it worse or better in terms of any movements or any time of day or anything like that?
Oh, if I'm walking my dog and she pulls on me, or if I go to buckle my seatbelt, it kind of hurts, just certain
Okay,
movements
reaching
like
behind
that.
you. Okay, all right, fine. And you had mentioned the fast heart rate, and the nurse had pointed out that your heart rate seemed a little bit elevated today. Does it feel like it's just going fast, or do you feel like it's skipping beats every now and again?
I think it just goes fast.
Fine. Any shortness of breath, lightheadedness, or dizziness when it kind of starts going fast?
I had some dizziness when I had my headache a little bit, and if I lean over too rapidly, I get dizzy.
Okay. How often have you noticed that going on?
All the time.
All the time. Okay, all right. What's your caffeine use like?
Well, today I'm in a deficit because y'all aren't letting me drink my coffee. On usually 2 cups of coffee a day, and otherwise I just drink water.
Great. No energy drinks?
Absolutely not.
No, okay. No,
Some espresso, if a drug rep will bring it to me, I'll put it in my coffee. Yeah,
sounds
it's
nice.
wonderful.
no use of any over-the-counter medications that have decongestants in it, or Sudafed, or?
No, I do
nose
take an
sprays like that,
Alivert
right?
sometimes, but it doesn't have
See, that would
decongestant.
count as a medication, though, we kind of asked for
It's
that.
just sometimes, I don't take it all the time.
Okay, all right, fine. Okay, so, we've already talked about the headache, we're gonna get into that a little bit deeper. We'll also kind of, check out what's going on with your heart rate being a little bit fast, and take a look at this shoulder pain that you're talking about. Any other concerns, anything else that we need to address? No, okay, all right, excellent. All right,
Get it done.
let's give you a look and listen then. All right, just hang out, relax, and just kind of breathe normal here.
So while you're doing this, you're telling us what you're listening to, okay?
I'm listening, I'm auscultating over the aortic region, I'm over the first pulmonic, second pulmonic, so on and so forth, right?
Do you want us to be saying our landmarking or?
Do what?
Saying our landmarking or just saying like aortic?
Either way.
We're able to visualize and make sure you're in the right space. Yeah, if you're here saying you're in the aortic,
Yeah.
then that's something that we'll talk to you about. We'll
That
call you out
being
and we'll
said,
say,
if you're
you know,
here and you're saying exactly, if you're
Yeah.
on the wrong.
Yeah, if you're over the clavicle and saying, you know, right, we're gonna call that out. That's where we'll interrupt you and say, you sure? Let's think about where the aortic is supposed to be. And then that's when you can go look at your cheat sheet and, or whatever the case may be, right? Okay? So we run through all of our heart areas. All right. Big deep breath hold. Good, breathe. Good, big deep breath hold. Good, excellent. All right. Check some pulses here for just a second. We're verbalizing our pulses, right? Subbrachial, radial, popliteal, dorsalis pedis, posterior tibialis, 2+ symmetric. You guys get the gist, right? Okay. All right. Big deep breaths for me, in and out through your mouth. Okay, excellent. All right. Okay. So I call this my silly game test. You'll see why in a second. I'm not messing with you. There's a reason why I'm doing this, especially with you talking about the headaches. Okay, I'm just trying to make sure there's not anything that we need to really kind of dive into and get worked up right this second, like maybe a scan of your head, or hey, do we have some time here? Okay. So smile for me. Great. Show me your teeth. Great. Stick your tongue out. Move it side to side. Open up. Say ah. Good. All right. Eyes closed. Arms out. Palms up. Like you're holding up 2 pies. Good. Open your eyes. Squeeze my fingers. Good. Give you a nice good shoulder shrug up and down. Great, chin down to your chest, come back up, puff out your cheeks. Good, frown for me,
I can't.
wiggle eyebrows up and down.
I really probably can't do that.
Actually, one of them just moved,
Like,
so.
just a little, I'll touch that up.
So, and we'll feel me touching on both cheeks, feel the same on both sides, yes? Hear that okay? Hear that okay? Good, push your head over here, push your head over there, all right. Follow my finger with your eyes, keep your head nice and still. Good, looking straight at me, tell me when you see my fingers start to wiggle.
Yeah,
Good,
yeah,
good,
yeah. Yeah.
good. Fingers to thumbs, one by one, go all the way down the line. Excellent, relax this arm, give it to me for just a second. Where are these bruises from?
That would be my dog Harley.
Same thing over here? Okay. Not from a fall from the dizziness?
Absolutely
Okay,
not.
uncross your legs, let them hang, let them dangle. Good.
Kick you.
Okay, all right. Okay, hop down for a second, just let me see you walk for a moment. Good, come on back, stop right there for me, so just like when I had you sitting up on the table, close your eyes, arms out, holding up two big pies. Okay, open your eyes, feel like you were standing still or moving around at all.
Moving.
Side to side or front to back?
Let's try it again. Side to side.
Okay, all right. Okay, fine. All right, let's sit right here.
Side where you can reach it.
Yeah, fine. Focus, something straight ahead against the wall. Bright light in your eyes for a moment. Sorry, I know you said that the light was a little bit sensitive last night when you're having a headache. Was it right now?
No.
No, okay, all right, fine. Let's kind of check out this shoulder for just a minute. So you had said it was worse when you kind of reached behind you and when you would walk the dog, is that correct?
Yeah.
Okay, all right, fine, okay. So go ahead and, what's more comfortable for you, sitting or standing? I can go either way.
I don't care.
Okay,
What do you wanna do?
all right, let's do standing. Okay, all right, so just let the arm hang, just relax it for a second. Any pain coming across right here?
No.
No, good with that. Any pain back here on the back part of the shoulder blade as I work my way around there?
Just right there.
Right up here, okay. So more in the shoulder blade or more up into the muscle up here?
Probably the muscle.
The muscle, okay, all right. Any pain right here?
Not really.
No? Okay, any pain right here when I do that?
Not until you push really hard.
Okay, no pain with that, right?
No.
Okay, pretend you're holding on to a pole for me. So come up to a Statue of Liberty position for me. Great, come back down, tuck your elbow all the way into the side, swing and negate, open and close for me. Push out hard on me, good, pull me in. All right, relax the arm, let it hang. I'm gonna lift it straight out to the side. I'm gonna get to a certain point, I'm gonna let go. When I let go, try not to let it drop or fall. Good, all right, let it hang. All right, now I want you to act like you're holding two giant cans of beer, just like this. Thumbs up like that, perfect. All right, good. Push up on me, great. Push down on me, good. Pour your beer out on the ground. Push up, push down. Great, relax your arms, hands behind your back. All right, I want you to take this hand and try to reach up and scratch that shoulder on the other side.
Ow.
Okay, all right, painful, but you can do it, all right. Now I want you to take this hand and try to push it off your waist like you're throwing it through the wall behind you. Now bring it back to your waist, you're gonna bring me back with you. Try to resist you. Excellent, nice little pop right there. All right, hands behind your head. All right, just take this hand, reach down and scratch as far down on your neck as you can.
Hurts.
Okay, okay, relax, let's check it off. Bring this arm directly across your chest like a bird or a hawk's about to land on it. Relax all of this, give it to me for just a moment.
Did you feel the puppy?
Yep, in your wrist, yep, okay, all right. Now, arm straight out, thumb down. When I say go, you're gonna start to kind of bring your arm up like this, fingers pointed at the sky. I want you to try to get your bicep near towards your ear, okay? I'm gonna push down on your shoulder and I'm gonna push down on your wrist a little bit doing this. All right, and go. Okay, excellent, all right, let it hang. Since you had talked about that the pain was more in this muscle and that you get some shooting pain sometimes and the headache sometimes travels down the back of your neck, I'm gonna check out your neck for a minute. Any pain or discomfort as I come directly down your spine here at all?
No.
No? Okay. All right, so I want you to look over this shoulder like you're backing car out of the driveway, great, back to the middle. Other shoulder, back the car out of the driveway, great, back to the middle. I'm gonna push down on your head for a minute, I'm gonna let go. When I do, I want you to tell me if you feel any shooting pain traveling down either arm, all right?
No.
No, all good, okay. All right, have a seat for me. All right, and those would be the only systems that I would assess based off of her complaints. That's 1840. Okay, so. So questions about that? Did we cover everything that was on the rubric in terms of the subjective that we're supposed to do? Then when got into the objective, chose to do cardiac, neuro, with a Romberg because she complained of some dizziness with positional changes, right? Okay. And then the shoulder exam, but because the pain was kind of in no man's land, we didn't have any weakness or limitations with any of the special provocative testing. Range of motion was good. Wanted to clear a neck because also talked about the headaches, pain coming down the back of the neck, and talked about shooting pain that traveled down that arm, right? Okay. So it was a double musculoskeletal with neuro and cardiac, right? Okay. So sounds like a lot, right? But there's 11 and a half minutes still left on the clock, okay? Now, if you factor in time for having to verbalize your findings as you go, I would say add on maybe another 3 to 5 minutes, but still well within the time frame of the 30-minute window, right? Okay. So,
So A, when you're verbalizing like with neuro, when he was having her follow, what cranial nerves was he testing right there? 3, 4, 6, right? So you could just say, you know, follow my finger with just your eyes, keeping your head still. As you're doing that, you're just saying, I'm assessing cranial nerves 3, 4, and 6. That's what we're talking about verbalizing. Does that make sense? Okay.
And then on the shoulder exam,
Ocular motor, like that, you want us to be saying like 3, and then the name of the cranial nerve?
so let's make a determination here as faculty. What are we okay with? Are
I
we
want
okay
them to
with
know
the-
both, but they don't have to verbalize both unless we ask them
I
at the
would say
end.
just 3, 4.
Yeah.
Like
Okay.
either one.
Okay.
It's your, if
Like
you're
Your call.
more
Your
comfortable
call.
with,
Yeah.
Okay.
Your
Because
call.
you're all going to have it written on your sheet.
Now, if we think,
I
now if
guarantee.
you verbalize, so don't think that you can just call out a bunch of numbers like this is bingo. Right? We're gonna be like, we're good. Right? So we catch you doing that, we're gonna say, hey, stop for a second. Tell me what those cranial, right, okay? So, we can't, there's gonna be.
if you're doing this and saying cranial nerve 5, we're gonna be like, what,
What's that?
we do know our
What's it
cranial
called?
nerves.
Right, so, but yeah, whatever you wanna do. In essence, again, of the running clock and time, it's probably quicker just to call out the numbers than it is the names, right? So,
And then knowing your musculoskeletal test, like which ones he did, what is that testing for? If you're doing extension and you say, well, I'm testing flexion,
Yeah.
those type of
Question.
things.
Question, you didn't go over the review of systems. Did you
So
like completely?
I did that, so I did that as I went, okay?
Okay.
Kind of focusing on what she was giving me. So I did a lot of that. I started doing that, we established she complained of headache, right? As I started going through the HPI, I started doing ROS with the HPI, and then we got into a few other things. Yeah, I didn't do a complete ROS.
But you
You-
did,
Just
you
the
did,
part
why did
Bas-
you not? Cause you
I didn't-
asked me about if I was
I asked-
married, if I had
well-
kids,
No,
what's
review of
the.
systems.
In the ROS.
Like,
I didn't do,
GU, you know, like
Oh, yeah,
Yeah.
those are
So
focused.
again, not pertinent to, you know, to what was going on, right? This was more of a focus thing. So I mean, the only thing that I left out was, ENT, I just focused on eyes, right? I didn't ask about, you know, ears or nose or throat. You know, eyes was the only component based off of what she was giving me in history-wise to kind of get into. I did cardiac, I did respiratory, asked about GI in the sense because she had talked about nausea but no vomiting, asked if there was any abdominal pain associated with it, right? She said no. Didn't ask anything in terms of, I guess, neck or lymphatics, or psych. But everything else I think was covered, right?
Are we having
Okay?
them? I thought we were just gonna have them do a
So-
focused ROS on what.
They need to be prepared if they pull a, hey, they're here for their annual wellness, then yeah, there needs to be a complete, okay? But otherwise, it needs to, you know, you can do just like what I did, okay? All right? So, you need to make sure that you thoroughly explore the system or systems that you think are, that need to be assessed to make sure, because if she had talked about, an actual visual deficit going on right now, then that would have prompted a fundoscopic exam. You know, would say, hey, I would get the Snellen and we would do some more testing in that. But she had said everything had resolved that night, that there was no photophobia going on currently, that when I ran through her cranial nerve exams, there weren't any deficits then, or this, that, or the other, right? So,
And if, are they gonna have a site, or someone gonna have a site complaint?
Oh, yeah,
They
there'll
have
be
to
site
say they were gonna
complaints.
refer the,
Yeah.
whatever.
yeah,
site
there'll
people do.
be site complaints, certainly, right?
Like, you don't have to do.
And those don't take long,
Which-
right?
Don't
which-
you
Not
say-
in this scenario, because
say
we're not
everybody-
asking you
what are
to.
the some of the tests
I'm
called?
gonna, I would give the appropriate, you know, the patient seems to be exhibiting signs of depression. I would give her the appropriate screening tool for depression, such as a PHQ, okay? Patient seems to be exhibiting signs of anxiety. I would, you know, whether it's ADD, ADHD, whatever the case may be, right? Just, I recognize or think that it's this, or they're exhibiting signs of this. I would explore it further with the proper screening tool.
But they don't have to go through all the questions on.
In her case, based off of the family history, with her talking about that her first degree relative, her sister, had a significant psych history, I probably should have thrown in psych in the ROS, right? That would have been very reasonable to have touched on. But, yeah, okay.
So we do need to know the specific screening tools.
Like what tool you use for depression, or what tool you use for anxiety or ADD?
PHQ for depression, GAD for anxiety. If you think there's some sort of mood disorder, okay, and there's several, but we would just say MDQ is the generic mood disorder questionnaire, okay? If it's ADD, ADHD, for the adults, you would just say the screening tool that we utilize, or several, we use the ASRS, but you could just say, I would use an adult ADHD screening tool, okay? If it's kiddos, it's Connors. Just say I would do an adult ADHD screening tool. If it is, if they're talking about sleep issues, then there's several different sleep screening tools. You need to try to differentiate between, is it insomnia, or do we think that this is something like obstructive sleep apnea, okay? And you would need to identify what they seem to be exhibiting symptoms of most, and you would say, hey, this patient is exhibiting, you know, signs more consistent with possible obstructive sleep apnea. I would do a stop bang or an Epworth sleepiness scale on them. If it's just more of insomnia, they have difficulty initiating sleep or sustaining sleep, and there's no concern for OSA, then there's a bunch of different insomnia tools that can be utilized. You say I would ask them about, you know, you should go ahead and ask them about sleep hygiene. Okay, there should be a question about that, but you would say, okay, at this point, I think it's more of an insomnia issue because they're having difficulty being able to initiate sleep. So I would use an insomnia screening tool to get further information to move along. Okay? You good with that, since you're a resident
Mhm.
psych expert? So, once those of you that are on the psych tract, once you guys have already learned a little bit more, I think this semester, no, you guys don't have diagnostics anymore, you're a secondary farm. Next semester, you'll get more of an indoctrination into some of those more specific tools and, you know, how to utilize them and what the scores represent and this, that, and the other. All those tools, by the way, that I just mentioned, is also everything those of you on the family tract, need to know about. We don't get into all the DSM-5 stuff and this, that, and the other, but all of those tools that I just mentioned are tools that we utilize and practice, every day. Okay? So you guys will get more familiar with that, in the coming semesters as well. Right? So, questions, anything with that? Yes? Possibly, possibly.
We're still arranging patients, so it's possible that somebody's
gotta
gonna
be-
end up with my 10-year-old.
You gotta be prepared for
Good
PD
luck.
to Jerry, right? That's what we treat on our, that your license is gonna cover you for, okay? No matter which tract you're on, okay? Obviously, we aren't giving you a freaking kid that can't verbalize, you know, it would be an age where they can interact and have a conversation. Same point, we're not gonna give you some demented 90-year-old, although that would be highly entertaining. So, okay?
Hey, I do wanna say something, as you guys go further on in your clinicals after this semester, don't be afraid to ask patients questions when you notice that something's wrong.
Yeah.
So I had a student with me this week, we literally had somebody come see us for allergies, and she walked in with a helmet. So I asked my MA as they came out of the room, why is she wearing a helmet? I was like, she doesn't have anybody with her, I don't think she has like a psychiatric problem. She had a craniotomy, I kid you not, she didn't have skull on half her head, and she's there worried about her allergies, and I'm looking at her like, but I had to ask questions, cause that patient wasn't gonna offer any information, like, if I'm wearing a helmet,
We're always gonna
I
talk
would
about,
tell,
we're
like,
always,
a medical
while we're
provider.
asking, while we're asking questions and doing the subjective, we're always scanning up and down.
Yeah.
What did I address with her during my exam that I noticed the second I walked up to her?
Bruises.
The bruising, the
Yeah.
ecmosis on the arms, right?
but their
Okay,
eye,
what's
like
that
pupils,
from? So-
people walk around with uneven pupils all the time,
Yeah.
ask them why. Like, don't ignore it. I'm one of those people, I can't quit staring at it, so I'm like looking at them as they're like talking, and finally I'm like, I gotta know what's wrong with your eyes. You know what I mean, like, cause you're gonna have to tell me, you know, it was like an injury from childhood, but don't be afraid to ask those questions, because you will impress your preceptor if they have you go in there first and assess the patient. If you come out and are telling them all these things about why they are there, and then they walk in and they see something like that and you didn't address that, they're gonna be like, why'd you ignore that? Because you're ignoring it. Like, I sometimes don't wanna ask people if they're dizzy because I don't wanna have to address that they're dizzy, cause it's a big appointment, right? But you have to ask all the questions, so keep that in mind as you go forward, okay?
I don't know at what point you walked in during this scenario, but since you're also, in addition to our resident psych expert, or resident neuro expert now,
Oh, yeah.
any issues with the neuro exam or any other tricks that you learned from Bartel or anything that's,
Like I said, with neuro now, it's getting pretty deep, so headaches, you know, probably would do some additional testing or refer out. Probably try them on some meds first, and then to see, but if it was, depending on how severe it was, probably refer out to get some
but
additional.
assessment wise, you would find.
Yeah,
I would have
with the
asked
neuro
for ear
exam,
pressure, changes in hearing,
Yeah.
because those are signs of a migraine as well.
Just wanna make sure Dr. Cleese didn't have any other,
Yeah.
cranial nerve assessment tricks or call me out on anything, going, yeah, that's crap, you don't know what you're doing. So,
Frank is the same way, you know, like I said, when he said he watches the patient from the time they come in, from the time they leave. I mean, I start, you know, by introducing myself, she complained, I had a patient come in this week. She said that she had agoraphobia, where she's afraid to leave the house. She was shaking the whole time we were in the appointment. I made it clear that she could just be calm and relax with me, that I was there to help her. She had a lot more going on, just some anxiety. This lady had a list of diagnoses that she told me that she had been treated with. I mean, when the list went down, I couldn't keep it up enough trying to dictate it. But anyway, it went back. She had depression, social anxiety, agoraphobia. She had a lot of family history with different mental illness. you know, boyfriend problems and just the whole list. So, you know, you have to address all that. Like, when did this start? How long has it been going on? I mean, have you had treatment? She said, yeah, I had treatment 20 years ago, but I stopped the medications, and that's one thing. Why'd you stop them? Well, I thought I was better, and that's what you'll get from a lot of this that think they're better. So we went on and on and on. So at the end of the visit, it turned out to be pretty good. We continued some meds. I started on some meds. Basically, she wanted some medicines for ADD, which when you're in the psych field, you would know that they're very med seeking. So all her anxiety was really, I have ADHD, and you know, so I started on some Strattera instead of giving her what she really wanted, because I knew what she wanted from the beginning. And you're not like just stereotyping, but when you get into psych, you will notice that everybody needs some Xanax, everybody needs some Metamed, they all need stimulants. So yeah, just watch them from the time they enter or I introduce myself to them, I'm looking, I'm observing. I mean, as I'm asking questions, you can pretty much, as you keep going from head to toe, it's still a head to toe assessment. You know, I start with, you know, why are you here? The chief complaint. You know, let's talk about it. When did this start? I asked him about sleeping, as he mentioned. Some people have difficulty sleeping. Well, what is it that's keeping you from sleeping? You know, or some of them will say, my brain just never shuts out. And then you are kind of thinking, okay, like, is this some type of mood disorder? Or, you know, like they can't sleep. And, you know, what, have you taken anything for it? You just keep going. And are you eating? You know, how do you eat? How do you know, how many hours a night do you sleep? And I just keep going down. So the same head to toe assessment, I'm doing that head to toe assessment. I'm going straight down from the top, and I'm going all the way down. And I'm going to their family history, you know. Like if there, you know, anybody with a history, you know, do you talk about your children, talk about your education, when did you go to school, you know. So exactly, you know, and I always, this is me because I'm family insight, I'm, you know, any chest pains and shortness of breath and difficult breathing, I'm doing my ROS the whole time I'm talking to them. Like I want to know any problems with, you know, musculoskeletal, you know, do you urinate? Okay, all that stuff is, you know, it may not seem important, but that is all part of psych until I get down into where I'm trying to go with them and find out. So, I mean, I'm not gonna be in there like trying to make you guys come up with some big diagnosis, but just, you should be able to know what the depression, some of the signs, the symptoms you look for depression, with anxiety, if they have ADD. Brent can tell you one time we did a clinical setting, and I gave this lady a child with ADHD. Remember, she had the panic attack, and we had to like pull her to the side and redo her. I mean, she was like, I work in ER, I don't know anything about children. It was straightforward. I mean, there's no reason not to do it. So I personally am not gonna be in there trying to make you guys feel, you know, like you don't know, but I expect you to just be able to tell me the basics and move on, because as you move on, then you're gonna see that it's gonna get deeper and your assessments and stuff will be much more detailed than probably what you're getting here.
All right, so here's what we're gonna do. We'll take a 5-minute break. We're gonna come